Welcome back, everybody, and welcome to our first breakout for the afternoon. I have the pleasure of introducing Dr. Jennifer Mundt, and she is a sleep psychologist at the University of Utah and is board certified in behavioral sleep medicine. Dr. Mundt's research focuses on developing behavioral interventions for central disorders of hypersomnolence and on investigating the family impact of these disorders. Thank you for coming, Dr. Mundt.
All right, thanks everyone for being here. Excited to talk to you. So I'm going to be talking about nightmares, which really I think are an overlooked symptom kind of in general, but especially in central disorders of hypersomnolence. So I want to shed some light on that today. All right, so let's get to the topic for today, which is nightmares. So I'm going to try to answer a handful of questions in this talk. So we're going to talk about how nightmares are defined, how common they are in central disorders of hypersomnolence or CDH, what the impact of nightmares is, both at nighttime and daytime. We're going to talk about how nightmares might be different in central disorders of hypersomnolence and talk about whether they can be treated. So I have done a pilot study on this, and I'm going to talk just briefly about the results of that and sort of some upcoming research that I'll be doing. And I'm just going to have my phone out so I can just keep an eye on the time as we're going along here. Okay, so to define nightmares, so nightmares are considered a REM parasomnia. So you all probably know that there's sort of two types of sleep. There's non-REM sleep and REM sleep, rapid eye movement sleep. So there's different parasomnias that will happen in non-REM sleep versus REM sleep. So these are a REM parasomnia, and they're defined as dreams that are extremely disturbing, extended, and well-remembered. So that well-remembered is a really key component. So there's also a thing called night terrors or sleep terrors. Those happen in non-REM sleep, and usually people don't remember much. There might be a little bit of a snippet of a dream. They may not remember it at all, but that's where people are like screaming, and it might disturb everyone around them, but the person experiencing it might not remember it. So in a nightmare, you're remembering the dream well. Typically, nightmares will cause an awakening, and you'll quickly become alert and oriented. So that's kind of the classic definition of what a nightmare involves. So when we look at how common nightmares are in adults that have central disorders of hypersomnolence, I've summarized here in this graph data from this paper. So this is looking at adults, hundreds of adults who had either narcolepsy type 1 or 2 or idiopathic hypersomnia. So the red is narcolepsy type 1, orange is type 2, and then the yellow is IH. And this is looking at over the last year, did you have at least one of these parasomnias? So you can see nightmares were the most common parasomnias in the previous year. So across all three of these diagnoses, at least 80% of people said they had at least one nightmare in the last year. Compared to some of these other parasomnias, which are also common, like the sleep-related hallucinations and paralysis, those were still pretty common, but not as common as nightmares. And then REM behavior disorder, which is where you act out your dreams. So 41% of people with narcolepsy type 1 had that. So with all of these, you can see that generally the people with narcolepsy type 1 are having more of these parasomnias than people with type 2 or IH. And then sleep-related eating is also on there. That's a non-REM parasomnia, and that wasn't all that common. So in this study, a lot of people were having nightmares. And so I think this brings up a few possible explanations. So one, are nightmares actually just the most common parasomnia in these conditions? Are they even more common than these things that are part of the narcolepsy pentad? So hallucinations and the sleep paralysis are part of this narcolepsy pentad. Maybe nightmares are more common. Maybe it's that the medications people are taking for these conditions, maybe they address some of these other symptoms better. Like maybe it's actually addressing things like the sleep paralysis, but it's not addressing the nightmares. Or maybe medications people are taking for these hypersomnia conditions, maybe they're causing more nightmares. So we don't know. I think those are just a few possible explanations. But for whatever reason, nightmares are really common. If you're comfortable raising your hand just in the audience, who's had a nightmare in the last, let's say in the last month? Have you had a nightmare in the last month? Okay. And what about in the last week? Okay, so quite a few people. Yeah, so this is just looking at in the last year. I ask about the last week because that's typically how we'll define nightmare disorder, is if you're having at least one nightmare per week. So when we look at the prevalence of nightmare disorder in adults, in just the general population of all adults, it's about 5%, which is a lot. That's 1 in 20 people. So this is actually pretty common. It's very common in people who've experienced trauma or have had PTSD. So that's 50 to 70% of people. But then narcolepsy is also really high. So this comes from 3 different studies that showed sort of a range of about 30 to 40% of people with narcolepsy are having at least one nightmare per week. And then just the one study, that one on the previous slide, showed that in idiopathic hypersomnia, 28%, so comparable to narcolepsy. So about 30 to 40% of people, from what we know so far, if we're looking at people with IH and narcolepsy, about 30 to 40% of people might have nightmare disorder. It's a lot of people. And this is something that I think just isn't getting enough attention in the research, probably also not in a lot of clinical care. So I just want to shine some light on this and talk about sort of what we can do about it. The impact of nightmares, there's a lot of different impacts. I've put on this slide some of the most common things. So at nighttime, of course, these can cause awakenings. You can wake up feeling panicky, sweaty, out of breath, your heart racing. It can be difficult to go back to sleep. Or what can also happen, what I've seen especially in hypersomnia, is maybe because of the hypersomnia, you kind of can't keep yourself awake long enough. You keep going back into it. That's something that I think might be a little different in some people with hypersomnia. So maybe you sort of keep going back into the nightmare if you can't stay awake. If you're having nightmares, this can also cause people to have a lot of fear and anxiety around bedtime. They might be afraid to go to sleep, may actually avoid sleep and try to stay awake in order to avoid nightmares because they can be so terrifying. So obviously that has some negative consequences. During the daytime, maybe you're more sleepy because if you're waking up more or you're having trouble going back to sleep or you're avoiding sleep, right, that could make you more sleepy during the day, which is the last thing we need in hypersomnia. This can also affect your daytime mood, right? Maybe you're feeling anxious from the nightmare. The sort of the emotions that were happening in the nightmare can really bleed into the next day. So you might feel anxious or sad. You might feel ashamed about having nightmares or feel embarrassed about it. So there can be these different kind of emotional effects during the day. Maybe you're also going about your day and you just keep thinking about the dream. You have these kind of intrusive thoughts or images about the dream and you can't stop thinking about it. So that can be really distressing to just keep having these very disturbing images and memories from that dream kind of popping into your daytime. And that can happen for a day, it can happen for a week, right? This can be sort of an ongoing issue. So this can really affect you during the daytime in many ways. We don't have time to sort of get the microphone around, but does anyone else just want to shout out any other sort of negative effects you've experienced from nightmares that aren't on this list? Any other thoughts anyone wants to add? Go ahead. Yes, we're going to talk about that. Yeah, it can get blurry, sort of what's real, what was the dream. Yeah, we're going to get to that. That's a really good point. Yeah, that's a very common thing, especially in narcolepsy. Yeah, go ahead. Not really, since I'm going to focus just on nightmares, but we can talk about that afterwards if you'd like. Yeah, so I'm going to focus just on the nightmares, the ones where you are remembering the dream. Yeah. So here's a few quotes. So in the research that I did, one of the things we did at the end of the study was some interviews with participants to find out about their experience. So here's just a few quotes. These are from people with narcolepsy who have nightmares. One person said, "Nightmares make everything worse." Another person said, "Nightmares are one of my most debilitating symptoms." Another person said, "I've always felt really dumb being affected by a nightmare. For a week, I'll be having flashbacks to the nightmare, and I always felt silly." And I think this really speaks to the fact that there can be this shame around nightmares. Everyone generally knows that in kids, nightmares are really common. Generally, nightmares aren't as common in adults, and there can be this sort of embarrassment of like, oh, this is a thing that only kids have, or no one else has these, and it can feel embarrassing or something you don't want to talk about. But a lot of people do have nightmares, and it's nothing to be ashamed of. They're something that are legitimately very terrifying. So even though it's, quote, just a dream, these are very real. These are very scary. It's something that your brain experiences as real. So these are very impactful. So in general, when we talk about nightmares in sort of the sleep science literature, typically they're talked about as being either trauma-related or idiopathic. So most nightmares, most people with nightmare disorder, it's going to be trauma-related. That's the most common type. I would propose that there's probably some additional types of nightmares that we should be talking about. So the first type that I'm going to talk about is narcolepsy-related, and I've published this paper about that. I chose to focus specifically in on narcolepsy just to make it a little more specific to this condition that's been a little better characterized in terms of kind of knowing what causes it. But I think a lot of this applies to IH as well. So I think there's narcolepsy-related nightmares is a subtype in its own. There's probably also RBD-related nightmares. So that's REM behavior disorder, the condition where you act out your dreams. So people with RBD will often have violent nightmares that don't come from trauma. They're coming from the condition. So I think that rather than just having idiopathic nightmares, we should start to think about what are these actual probably other causes of nightmares that people are having. And in narcolepsy, it kind of makes sense that narcolepsy itself could cause nightmares. So we know that in narcolepsy, especially narcolepsy type 1, there's all this REM disruption, and we think that that's what causes things like the sleep paralysis and the sleep hallucinations and the dream enactment. So I think of the nightmares as just one other manifestation of that REM disruption that comes along with it. But then there can also be other things that maybe aren't directly caused by the condition itself. And these could also apply to IH as well. So just the stress of having narcolepsy or IH, we know that stress can definitely affect our dreams. There's also higher rates of comorbid anxiety, depression, and PTSD in people that have hypersomnia. So those can also contribute to nightmares. And then sleep apnea is also more likely in hypersomnia. And sleep apnea can cause or exacerbate nightmares. So there's some other kind of potential factors that could be contributing to the nightmares. So I think there might be a combination of sort of maybe part of the hypersomnia disorder itself, maybe part of that physiology is contributing to nightmares, but maybe there's some other associated things that are contributing. And then to get to the point that someone else brought up, one of these other symptoms you can have is called dream reality confusion, this idea that you sort of are having difficulty differentiating whether something happened or not. So I think this list here of these things are what I see as being really unique to narcolepsy-related nightmares, is that you have all these mixed REM wake states. These dreams are extremely vivid, and you get these kind of mixed states. These are not things that I hear when I treat people with trauma-related nightmares or idiopathic nightmares. They're not telling me about having sleep paralysis or hallucinations or having difficulty differentiating their dreams from reality. But these are things that are very common in narcolepsy, kind of all these manifestations of this REM disruption and these mixed states that you can get. So one of my participants put it really well. She said, I spend so much of the night unsure if I'm awake or asleep. And I think that's what this audience member was getting at, this kind of sense of going in and out of sleep, and the lines can get kind of blurry. And again, that's only something I hear from people with hypersomnia. I don't hear that with other types of nightmares. So you can have nightmares that also combine with these other symptoms. So I've heard things like, I'm having a nightmare about sleep paralysis, and then I wake up into sleep paralysis. Or maybe I'm lucid, I'm aware that I'm having a nightmare, and you may or may not be able to change it. You can sort of wake up into, or sort of partially wake up into that kind of hallucination state where the nightmare is kind of continuing, but your brain's kind of half awake. So you can get kind of nightmares combining with these other parasomnias in ways that can be really distressing. So I think nightmares have really been an overlooked symptom because it looks like they are really common in hypersomnia. Clinically, just in general with nightmares, providers tend to not ask about them. I think in sleep clinics, we generally do a pretty good job of asking, but they don't always get assessed. And patients tend to not mention them. I think there's some different reasons for that. One can be that shame, or maybe just thinking, oh, these aren't nightmares, they really aren't that bad. Or maybe thinking, oh, everybody has these, and maybe your dreams really are different than everybody has. Also, most people don't know there's treatment for nightmares, so why would you bring it up if you don't think there's anything that could be done? I think that's a big factor. So even just among non-sleep health professionals, usually they don't know that there's any nightmare treatment. And so even like a psychiatrist, if they don't know that there's treatment for nightmares, they may not be assessing for them. So this is something where we really need a lot better medical education for health providers to know about this. And in research, medication trials for hypersomnia have not assessed nightmares. From everything I've looked at and been able to find, they're not assessing nightmares. They're often not assessing most of these parasomnia symptoms, but nightmares are not being assessed. So we have just this one behavioral treatment pilot study that I did that I'm going to talk a little bit about. But just to talk about the medications a little bit more, so for other types of nightmares, particularly trauma-related nightmares, prazosin is a medication that gets used, and there is evidence that that helps, especially with the trauma-related nightmares. But we don't know whether that helps with people who have narcolepsy-related nightmares. And there's lots of medications people are taking for hypersomnia. You might be taking daytime and or nighttime medications. And we don't know whether those help narcolepsy-related nightmares because, again, it's not being assessed in the clinical trials. So there's no prospective data where they've measured this intentionally to see what happens. So as of now, we have no treatment guidelines for this just because there's a lack of data. There's a little bit of retrospective data, meaning they sort of asked people, okay, what medications are you taking, and sort of were your nightmares better or worse before versus after taking this medication? And it's really just mixed results, so mixed evidence showing that antidepressants and sodium oxybate either helped or made the nightmares worse, so it's mixed evidence. One study showed that modafinil resulted in fewer nightmares, so it's really not strong data. What we need is some prospective data. We need all these clinical trials that are going on now to be collecting data on this so that we even know our nightmares or these other parasomnias being impacted by these medications. In terms of behavioral treatment, the sort of standard recommended treatment is called imagery rehearsal therapy, or IRT. So this is what's recommended in this clinical practice guideline from the American Academy of Sleep Medicine. And this is what's recommended for trauma-related nightmares and idiopathic nightmares. So what I did in this pilot study is we wanted to take that treatment and then do some adaptation, adjust it in some ways to make it better fit narcolepsy, and see how well that helped. And then we also had this lucidity intervention. I'm going to talk just briefly about both of those, but I'll give you just kind of the summary of the results. So this is a small pilot study, so the results need to be taken with a grain of salt, but it just gives us some preliminary evidence that this is effective. So basically what we found is that the treatment did result in lower nightmare frequency and severity. It also improved sleep talking and some other parasomnias, and then it also improved people's self-efficacy for managing their symptoms. What we did in the study is the participants got either just CBTN, so cognitive behavioral therapy for nightmares is sort of the new term for IRT, so that we're going to sort of be calling it CBTN in the field going forward. So participants got either just CBTN or CBTN plus this targeted lucidity reactivation procedure. And that's a procedure where we sort of tried to help induce lucid dream control while people were taking a nap in the lab. So to kind of give them that experience of having a lucid dream where they can control it, kind of like change their dream in real time. If I had more time, I would get more into that, but I'm just going to briefly touch on it. So for the CBTN intervention, this was 7 video conference sessions, and there's these core components of treatment. So this includes things like talking about different sleep habits that can impact dreams, grounding techniques to help sort of ground and orient and calm yourself after waking up from a nightmare, relaxation techniques, and then this nightmare rescripting, which is basically where you kind of rewrite the nightmare and you change it so that it's no longer a nightmare, and you practice that new imagery, and it actually shifts what you're dreaming about. So that's what the imagery rehearsal is about. This targeted lucidity reactivation, just in a nutshell what that is, so there's this idea that, so when you're awake, we can play these sound cues, and we're associating these sounds with lucidity. So we're kind of using this conditioning principle. So playing these sounds and associating that with having a lucid state of mind, and associating those with thinking about the desired dream that you want to have. And then when you're asleep, we can play those sounds, and your sleeping brain is going to perceive those sounds. And that will reactivate or trigger you to hopefully come into that lucid state while you're dreaming and to dream about that desired dream. So we sort of played these sounds and trained people when they were awake, and then when they were sleeping in the lab, played the sounds to try to help trigger lucidity and the desired dream. So in this study, these are the results looking at the sort of main nightmare measure, the Disturbing Dream and Nightmare Severity Index. So 4 out of the 6 participants by post-treatment were below the cutoff for having nightmare disorder. And then these are the averages for the number of these parasomnias people were having per week. So before the treatment, people were having 8.4 nightmares per week, and that went down to 2.3. They were having 7 sleep talking episodes per week, and that went down to 0.5. And then there was also some reductions in sleep paralysis and hallucination and dream enactment. Not every person had those, but so for the people that did have it, there was some reduction. But the first 2 were really what were statistically significant, so kind of the most reliable findings. And in those feedback interviews, the main things that we heard from people was that the intervention helped people to feel like they had more control, more ability to manage their nightmares, and it helped reduce their anxiety about sleep. So like we talked about before, if you're having nightmares, sleep can really become something that you feel fearful or anxious around. So feeling less anxious about sleep is great if you're feeling comfortable to allow yourself to sleep. I'll give you a few quotes from people. One person said, "My quality of sleep has improved exponentially. I'm not as afraid now of having nightmares. I have a way of handling it. I'm not anxious about going to sleep." And then another person said, "I feel less anxious and ashamed about my sleep." Another person said, "I'm waking up less throughout the night." So to build on that small pilot study, I'm currently preparing to start a larger trial. And since I moved universities, I started at University of Utah beginning of this year, so this trial has been kind of delayed, but we're hoping to get it IRB approved and get this started up soon. So we'll be recruiting, this is called the DAWN study, and we'll be recruiting adults anywhere in the US who have nightmares and narcolepsy, and everyone in the study is going to get CBTN. So look for that. Well, once it's approved, we'll have the advertisements posted like on the Hypersomnia Foundation website, so you can find information about it and contact us if you're interested in seeing if you're eligible. In terms of some future research, so I think one thing that I'd really like to do some research on is idiopathic hypersomnia, because the data shows that a lot of people with IH also have nightmares. So anecdotally, CBTN works. I've done this in my clinic. I just haven't done any formal research, so we need to have some formal research to get some data. So I want to do some pilot work on that, hopefully, to really demonstrate that if this can also work in IH. And I think for all the medication trials going on, so we heard this morning about a lot of medication trials happening, what I would really advocate for is that nightmares should be assessed as part of these. This is for many people, this is an important outcome that really affects their quality of life. And it'd be really nice if we had data to actually say, look, this drug helps nightmares or it doesn't help nightmares, because this is another symptom that I think a lot of patients would be really interested in knowing whether these medications actually help. And doctors that are working with patients need to know what medications might help nightmares. So I want to end with just some recommendations. So first of all, for people that have hypersomnia, if you have nightmares, I really encourage you to tell your sleep provider about them. And I think it's important to really communicate to them that these are nightmares, not just vivid dreams. There might be some misunderstanding of, well, yeah, people with narcolepsy have vivid dreams, but really make sure that they understand what you're experiencing and how it's affecting you. So that might mean telling them, these are so bad, I'm afraid to go to sleep, or they're waking me up so much, I'm more sleepy the next day. And that's really important so they can understand how it's affecting you and why this might be a treatment priority, something that you want to talk about and see, are there any medications to try, or can they refer you to someone like a sleep psychologist for treatment to see is there anything you can do. So bring it up to them and make sure they understand how this is impacting you and why it's important to you to work on. For any providers in the audience, I think just asking about nightmares, again, I think we generally do this in sleep clinics, but just making sure we're really asking people about this, and I think making sure we're defining nightmares, because when we say nightmares, patients don't necessarily think the same thing that we do. So we need to define what we're talking about. These are upsetting dreams that wake us up and disrupt sleep. And so it's important then for providers to be able to have a conversation about setting treatment priorities, about where does this fit into your priorities. So maybe addressing your sleepiness is the number one thing. Maybe nightmares are the number 2 or the number 3, right? We need to have a discussion about what are your treatment priorities? What are the things we really should be targeting and monitoring in your treatment? And also being aware that nightmares can be a residual symptom. So maybe there's other, maybe some of those key symptoms like your cataplexy, your sleepiness, maybe those are getting addressed by medication. Maybe the nightmares aren't. And so if that's a residual symptom, maybe that then becomes the next target that we're focused on. So I think there just needs to be some shared decision making around this and working together as a team with patient and provider to sort of decide what we're working on, what we're monitoring, so that we're working toward the same goals. And just some general treatment recommendations if you have nightmares. So aside from the specific nightmare treatment, addressing stress and comorbidities is one thing that can help. So your daytime mood has a big effect on your dreams and on your nightmares. So addressing things like anxiety, depression, PTSD. So that might mean not seeing a sleep therapist like myself, maybe seeing a more general therapist or a trauma therapist, someone that can help address some of these comorbidities, and that might really have an impact on your nightmares. Also, if you have sleep apnea, treating that, since that can also contribute to nightmares. So those are just some kind of more general things to think about if you have nightmares, to think about some things that you could be addressing. So that's all I had. I think we have maybe just time for a question before we have time for people to go to the next session. Is there any question before I let you go to your next session? Yeah, go ahead.
If you can't remember you're having these bad dreams, then then we're off the radar.
Sorry, what was the last part?
Then we're off the radar, off your radar. So,
Well, so those would just be addressed in a different way. So the sleep terrors, so typically what would happen with those is you might be screaming or yelling, and it's usually more disruptive to people around you. It's still a concern, right? Because it could really disrupt other people, or if you're the one doing it, it might disrupt your sleep. So those are treated differently. We wouldn't do that same cognitive behavioral therapy for nightmares, but there are other things we could do, like behaviorally, there's a lot of things we can do, like relaxation and hypnosis and making sure you're getting enough sleep. There's also different medications that are effective for those non-REM parasomnias. So yeah, those are still a concern. They would just be addressed in a different way since it's a different type of parasomnia.
And there is no test for that other than possibly if you're sleeping alone in the same room, you would not know, or other people wouldn't be able to tell you that you're experiencing this.
Yeah, if you live alone, because you may or may not remember it. If you come in and do a sleep study, they might see something on the sleep study, but yeah, typically it's sort of based on what other people are reporting to you. I think we're almost out of time. Was there another question back there, Diana? Or?
Can some people have both trauma nightmares and idiopathic ones?
Yeah, I think it's not either or. Even like with narcolepsy, you could have had a trauma history. So it might be that your nightmares maybe are a combination. Maybe trauma's feeding into it, but maybe just narcolepsy itself might be making it worse. Maybe it's creating like vivid nightmares with the lucid dreaming and these other components. So yeah, it definitely could be a combination. So yeah, I guess it wouldn't be, you couldn't have idiopathic and trauma related, but you could have like trauma related and maybe narcolepsy related, or trauma related and REM behavior disorder related. Does that make sense?
Yeah, totally. Thanks.
Yeah, could be more than one for sure.
Go ahead, Diana, with your question.
I tend to have hallucinations and sleep paralysis, and I've noticed in myself that they happen more commonly when I'm napping or when I'm sleeping in an unfamiliar place like a car or a plane or something.
Mm-hmm.
So I'm wondering, do you know of any other like triggers or things that commonly are correlated with sleep paralysis and hallucinations?
I am not sure why that would be more common in napping. That's a good question. And I know for all of these things, stress is often a trigger. I don't know, that would explain why you have them in napping. But I think what you're bringing up, though, brings up a good point that I forgot to mention, is just that's another thing that can be unique in narcolepsy, is having nightmares and these sleep paralysis in naps, right? So typically nightmares will come at the end of the night of sleep when we have more REM. But with people with narcolepsy, you can be having REM throughout the day and at the beginning of sleep. So you might go right into a nightmare at the beginning of the night, which is really different than someone without narcolepsy. Or you might have nightmares or sleep paralysis during a nap. I don't know what would be causing those to be more likely in a nap, though. Sorry.
Our next question in the last 2 minutes here is from online. Do you know what mechanisms might be driving increased frequency for vividness or of nightmares in patients with idiopathic hypersomnia and narcolepsy and other hypersomnolence disorders? Yeah,
that's a really good question. And I don't, because it makes sense, especially with narcolepsy type 1, all this REM disruption, but we don't see that same thing with idiopathic hypersomnia. So I am not sure if there's something sort of inherent in IH itself that would cause nightmares, aside from kind of those general things we talked about of like, well, having IH is stressful and maybe you have comorbid anxiety, depression, or higher risk of sleep apnea. I don't know. Well, we also just don't know what the underlying sort of physiology is of IH. So I think that's the million-dollar question that I would love to know the answer to, because it makes sense to me why at least narcolepsy itself could cause nightmares. I'm not sure why IH itself could. So that's something that we'll hopefully learn more about in the future.
We have a minute, so one last question.
Yeah, I don't have nightmares, but I have adult onset IH, and the way that it came on was like a month-long process of just every night very vivid nightmares. And I have this come back every once in a while when my condition seems to get worse. So I wonder have you ever looked at this as maybe not something that's a general symptom, but something that could be like an indicator of your condition worsening?
That's an interesting idea. I haven't seen any research on that, so there's been very, very little research on this. So no, I haven't seen anything that's looked at that kind of that time course, but I think that's a really interesting idea. I know there was this is kind of unrelated, but there was an interesting study a year or two ago looking at people with lupus, and they found that nightmares were actually an indicator of lupus worsening. So yeah, I think there's something like that where maybe the nightmares could be kind of an indicator of maybe it's sort of the underlying condition worsening. I think that's a really interesting idea, but it hasn't been investigated in any research so far that I've seen.
Well, thank you very much. We are at time, and everyone give a great round of applause.